Hi, everyone. Before we listen to this episode with Dr. Patel, I wanted to let you know that this episode is for informational and educational purposes only and does not provide medical advice. It's only entertainment. The views shared are general in nature and may not apply to your specific situation. Talk with Tara and the episode guests are not providing medical diagnoses, treatment, or prescribing advice. Always consult with your physician, pharmacist, or other qualified healthcare provider before starting, stopping, or changing any medications, hormone therapies, supplement, peptides, or wellness protocols. Hope you enjoy the show. Welcome to Talk with Tara, the podcast where we dive into the bold, the funny, and the fascinating. I'm Tara, your host, bringing you unfiltered conversations on life, love, and everything in between. Hit that follow button so you're always in the loop. And now let's get started. Okay, ladies, if you've ever been told your labs are normal, but you feel exhausted or foggy, you're not sleeping, you're gaining weight, you're moody, and your libido is like, goodbye, today's episode is for you because hormone therapy is so confusing. At least it was for me. The internet is loud with a lot of misinformation everywhere. And we're all going to talk about something people ask me about all the time, and they want to hear about all the time: peptides, including GLP-1s, glutathione, and the beauty peptides you see all over TikTok. We're spilling the tea on what's real, what's risky, what actually works. We're going to talk about hormones as well. And we are really lucky because today we're joined with Dr. Nayan Patel. He's a clinical pharmacist, educator, and founder of Central Drugs Compounding Pharmacy, a nationally respected facility specializing in personalized pharmaceutical care and bioidentical hormone therapy. He's going to tell us what that's about. He's had his pharmacy for over 2 decades. Dr. Patel has worked with functional and integrative practitioners to design precise hormone protocols. He interprets complex lab panels and supports safer, more effective patient outcomes. He's known for translating complex science into practical, actionable insight, which we love around here. He's been on 100 guest appearances and podcasts, so you may have heard from him before. But thank you so much for being here and educating our audience today, Dr. Patel.
Oh, thank you for having me here today. It's such a privilege to be here today, so thank you for that.
Thank you. Thank you. So let's kind of do a level set for our audience. What is a bioidentical hormone replacement? What is it, the therapy? What does it mean?
Well, it means that we are dealing with hormones that are actually produced by human body. Now, our body produces a set of hormones. These are the gonadal hormones, which is the estrogens, progesterones, testosterones, DHA, pregnenolones, and all those things that stems from cholesterol. All those hormones chemically have to be identical to what a body produces. And the pharmaceutical company has distorted this reality for us for over a century, telling us that hey, all hormones are the same. But if they're chemically not the same, then they don't function the same. So the bioidentical terms only means that chemically, these hormones are identical to what a body produces, even though we are taking from outside sources.
So the patch that we use, the progesterone that we ingest, the testosterone we put on their skin, I don't know if that testosterone counts, but they're like the hormones that we have in our bodies, and GLP-1s, basically.
And yes and no, right? So some of the patches of estrogens, some of them are bioidentical, which is estradiol by itself, and some of them are not. So it all depends on which patch you're getting. So actually all the birth control patches are not bioidentical.
Okay. How do we know? How can we tell which ones are not?
And so here's the thing, right? It has to be just say estradiol.
Okay.
Just say estriol, USP. If it just says this one word, then it's okay. But if it says anything else besides that, like ethylene estradiol, it's not the same.
Okay, got it. That's a good tip.
And so we have to be very, very careful. Or just ask your pharmacist. I said, hey, is this considered bioidentical? Is this the same chemical structure as a humanly that we produce human or not? And the other thing that people will, another question you're going to ask them is, hey, if this hormone is something the body produces, how long does it take to get out of your body? If it takes you more,
the life. Half-life, is that what we call it?
Half-life is what we call them. If it's more than 12 hours, that means it's not identical to humans because a body produces hormones and the body has a system to get rid of it. as fast as
Right.
possible because they're angel of life and angel of death. Too much can kill you, too little you can function. The right amount is all you need. And making sure that the right amount is there all the time, the body has a system to produce and get rid of it, produce and get rid of it all day long.
Okay, you may not know the answer to this question. You may know the answer to this question. How does estrogen, the patch, when you are going through perimenopause or menopause, how does it help you to not have the night sweats and not and to be able to sleep better? What does
So,
it do exactly?
okay. So this is a very, very difficult question because I'll give you the answer because I know what the answer is, but just that for people to comprehend this concept is very difficult. And here's the why. Because when you go into perimenopause, we didn't go through all the stages of life yet, but I'll just tell you, perimenopause is the most difficult time of a woman's life in the whole in the whole lifespan that you have. If you're going to live to 80 years of age or 90 years of age, the life from 40 to 50, which is the perimenopausal time, is the most difficult time of your life. And if you can master that, your whole life becomes blissful. Okay, so
Mm.
let's just talk about that one.
Okay.
What's going on during that time frame? What's
Okay.
happening is that your pituitary hormones, which is FSH and LH, is actually rising slowly. That means it's coming to a near term where your number of eggs in your bodies are reducing. So the body has to produce more of the pituitary hormones to make sure that those eggs are available to get fertilized to have a baby. That's the whole purpose, right? So when those FSH levels are rising, so is your estrogens are rising,
Okay. Okay.
right? So the symptoms of night sweats and hot flashes and all those things are coming from not because of low estrogens, because from too much of estrogens.
Oh,
Ah,
interesting.
okay.
Okay.
So now the symptoms in perimenopause and menopause are sometimes identical, but the reason for the symptoms are not identical. In
Mm.
perimenopause, there's a very, very high probability that the symptoms are coming because of too much of estrogens, not because of not you don't have enough of it. Now, here's the thing that you asked me a question is if I use a patch, how does it work?
Yeah.
And the way it works is that whenever you take hormones from outside sources, your own body's production goes down to zero.
Mm.
So when you give a low dose hormones of estrogens from like a patch, right? Your body's own production goes down.
Wow. Okay.
So
This
you
is so good because I've interviewed so many people about, going through this stage, and I had no idea it's because we're producing too much, and the
too
patch
much.
actually kind of stops that and it puts the exact right amount, I guess.
Well, no, it does not. It doesn't produce the right
Okay.
amount. Only thing the best the doctors can do for you is stop the production. But that does
Oh,
not mean is going to make it better for you because if they give you the wrong patch and if the patch is not strong enough, it will actually increase those levels of estrogens. And now you are in a bigger problem than you first begin with it now. Now you have way too much hot flashes, way too much night sweats, but now you have breast tenderness, fibrous breast disease, headaches, water retentions, and if there is any potential for cancer growth, it's going to increase really fast. So
mm,
to me, I cannot take a chance. If it's my wife, my daughters, my mom, anybody in that age group, I would never, ever prescribe estrogen as my first line of defense. Never do that.
mm,
There's other alternatives that you can do to counterbalance that part. Like always keep in mind, the hormonal cycles is the end of the endocrine system. So
mm-hmm,
if you look at the endocrine system that regulates all your symptoms in your body, the bottom, which is the base of the pyramid,
mm-hmm,
is actually 40% of the base, which is the management of the whole endocrine system, comes from your cortisol or stress management.
mm-hmm,
The next 30%, which is the second layer, is insulin or your diet management.
mm-hmm,
The next 20% is your thyroid. And the last 10%, the tip of the whole pyramid, is your sex hormones. You're here to regulate all your hormonal issues with just 10% of the total solution.
Mm.
In reality, everything has to be in a proper balance.
How
And
do you
so when I
recommend? Yeah. How do you recommend going about
so
that?
so my if you read my introduction, I said, hey, I
Mhm.
take all this complex lab testing, try to bring it down to simple solution because our brain can only you will only do things if it's easy for you.
Mm-hmm.
If I tell you that, Tara, take this one pill and you lose 10 pounds, done. Give me the
Mm-hmm.
pill, I'm done. If I
Yeah.
tell you that, hey, you have to exercise 30 minutes a day, you have to drink clean water only, you cannot eat past 7 p.m. at nighttime, you have to sleep 8 hours a day, all those things to lose 2 pounds. Don't you have a pill?
Yeah.
Right?
Yeah. Yeah. Yeah.
So people do not do things because it's the right thing. People do things because it's convenient.
Okay.
My job is to tell you what the right thing is, give you something so that you can do something so you can see the benefits of what hormone balance looks like, and
Yeah.
then push you towards doing the right thing because the right thing can have a longevity. The pill is going to take care of the symptoms only.
Got it.
And
Okay.
I'm not here. I'm not here to just take care of the symptoms. I'm here to give you longevity because if you're going to live to 80, 90, 100 years of age, you cannot live that long in pain or suffering or having issues with hormone imbalances. You can live if you're fulfilling, if you feel fulfilled, if you're enjoying life, if you're doing every single thing.
Dr. Patel, I understand what you're saying, but I see a lot of women online talking about HRT and they're on the patch. So are these patches that we're getting bioidentical, and are you saying they're not enough, that they shouldn't be the first line of defense when we are having hot flashes and perimenopause symptoms?
Okay, so symptomatically, if you have the symptoms, yes, the hormones will take care of the symptoms. Is that a first line of defense? The answer is absolutely not. But that's the first thing we do use it because if I don't get your symptoms under control, you're not going to come the next month to me. If I tell you
Right.
that, hey, Tara, that I know you're having hot flashes and night sweats, but let's work on your eating habits. I
Right.
said, no, please get me something. Oh, let's work on your stress. Can you quit your job? I said, oh no, I need to find another doctor who can treat me better. So we got to make sure we do things in order, even though the order may not be something that I would like to do it, but that's what the consumers or the patient wants to do with it. Because if you have a problem, if I cannot solve the problem, I'm not going to come back to you. So
Right.
yes,
Right.
so the hormones
Uh-huh.
are the first solution. The question
Okay.
you asked me is, are all the patches good? And the answer is no, they're not. Some patches are only some patches are actually bioidentical, which is the estradiol only. Most patches are actually synthetic. The ethylene estradiol, which is a synthetic form of estrogens, their progesterone is not progesterone at all. It's progestins, which is a synthetic form of progesterone. So
Hmm.
they are not bioidentical at all. So the only patches that are identical to human body or human physiology is estradiol only. And those patches are good, but that's just one hormone. Our body
Right.
produces tons of different hormones. There are three types of estrogens. Then they have DHEA. DHEA is sulfate. You have progesterones. You have pregnenolone. You have testosterones, and they have all these other metabolites of all these hormones. They all have some sort of activity.
Yeah.
I cannot replace all of them for you. I cannot. But we can pick and choose like 3 or 4 or 5 different hormones that if we get this balance out these hormones correctly, our job is done. And so that's why we try to simplify the process by recreating those balance. I said the pyramid earlier. And
Yes.
the whole thing about pyramid is what? Is recreating this balance between the stress, the eating habits, the thyroid, and the sex hormones. All these things have to be done correctly. Because if you do those things correctly, it sends things up to your brain, the pituitary, the hypothalamus, that, hey, everything in the body is in order. Stop sending me signals. Because
Okay.
if it's not, the brain, the pituitary, is going to constantly send us signals that, hey, something's wrong, fix this, fix this, right? And so all these things have to be in proper ratio. So with the hormones, we try to recreate balance with our 4 or 5 different hormones. With the thyroid, there's only two. T4 and T3. And so we create those balance with those two hormones. When it comes to insulin, it's the diet management. So we talk about proper eating habits, the time you eat, how much you eat, things like that. So we can control your insulin. And when it comes to the cortisol, which is the biggest chunk of all your hormone balances, there's no medications for those, but we give you like 15 different ideas on how you can manage your stress and keep your brain level headed so you don't get too excited all the time.
Can you tell us some tips on cortisol? I know
Oh
that
my
I'm always
goodness.
running on like high cortisol. I could feel it because sometimes I can't sleep. My heart rate is up because of stress. What are some quick things that
So
you can give our listeners?
So I will tell you there's two different things that you need to watch out for, and I'll tell you based on those how I treat because uh, I didn't mention to you, but I most of my clients are all doctors.
Okay.
I don't see patients anymore. It's I've not seen patients in 15 years now. But all my contacts, all my patients are actually doctors themselves. Some of my celebrity clients, if they're billionaires, if they're top 10 CEOs, top 10 Fortune companies and CEOs of those companies, they can bypass the doctors and come to me directly, and I'll probably take the phone call from them. But no, I don't see patients anymore. And so their needs are different than a need for my average patients that are basically just have a family to take care of it. They have a job, they have to do this and do that. Those needs are a little bit different. So I'll give you both those answers because I think you
Okay.
should know that both
Yeah,
answers
I think that'd be great.
it's different. That's why. Because what you
Okay.
told me is, hey, I always have my cortisol always high and I'm always wired up and things like that. To bring the cortisol levels down, all you do is put in your favorite search engine box or your AI robot. Just ask them, give me tips to reduce cortisol without medications. And you're
Okay.
going to give a list of like 15, 20 different things. Cold plunging,
Oh,
deep breathing, right?
deep
Most people, are,
breathing.
most people are shallow breathers. You got deep breathe. That means the belly comes out, your belly goes in. There's things like that. Then you have eye gazing, so you see out in the nature and just gaze as far as possible and come to closer, as far as possible, come to
Wow.
closer. Something like grounding, where you just put your feet on the soil for 30 minutes. Then you
Wow.
have all this. Uh, there's brushing techniques where you brush all your toxins out of your systems. It's called Reiki systems and things like that. Then you have yogas and stretching yogas and Pilates. So all I'm trying to do is, what can you do to do all these things like multiple times during the day. Now, I don't suggest you sleep 3 or 4 times a day, but
Right.
you can do deep breathing 3 or 4 times a day easily, and they'll just drop your cortisol levels down like normal.
Yeah, that's
Now,
interesting. I think meditation and deep breathing change is like part of neuroplasticity.
yep,
I know that during COVID, I started deep breathing and meditating, and my whole personality changed. I mean, it's amazing.
yep,
I became just a kinder person. I became more patient, just a different person. So I really think people who say, oh, I can't meditate, you don't have to meditate. You just have to know how to deep breathe,
deep breathe.
take deep breaths,
And
right?
what you told me is basically your awareness increased. That's about it. And when
Yeah.
your
Yeah.
awareness increases, your whole thing just shuts. It just makes you much a calmer person down, right?
Yeah.
And
Yeah.
so
Exactly.
that gives my second problem. This is my high power CEOs, movie actors. They are jet setters, is what I call them. They don't have high stress. Their stress is off the chart.
Okay.
They burn off the cortisol by the time it's 10 a.m. in the morning.
Okay.
And then the rest of the day, guess what they work on? Adrenaline.
Oh,
So here's the problem. When you have a lot of adrenaline, you are at night when you want to go to sleep. Guess
can't sleep.
what? You can't sleep because you have technically your heart's palpitating, you have crazy thoughts, your brain cannot shut off, you're really tired, and you can probably fall asleep, but your heart's still beating off the chest. And so for those people, yes, meditation may work and cold plunging may work and all those things may work. But if I cannot get the adrenaline out of the cells, nothing's going to kick in. So guess what
Mm,
I do? For my
what?
those for those people, I give them T3, which is active form of thyroid.
Oh,
And if I give active form of thyroid, within 10 minutes, all the adrenaline is burned off. It's just poof, gone out of your cells.
wow.
And then literally the heart rate drops and they are snoring.
I thought T3 can make you more hyper.
There you
No?
go. And that's what everybody will tell you, that part. But in adrenaline junkies, which is what I call those junkies, right? These are
Oh,
all my jet setters. The
yeah, because
adrenaline
Dr.
junkies.
Patel's in Southern California, so he knows a lot of jet setters.
Oh, I got a ton of those patients.
Yeah,
I have Fortune 5 CEOs as my clients of mine. I have
yeah.
people that texting me 3 a.m. in the morning.
Oh my gosh.
I said, dude, I'm sleeping. So now I turn my cell phone off and I literally
Uh-huh.
put them on a notification where I'm sleeping. I don't care what you're doing. And if you're not sleeping, follow my lead and just do what I told you to do. And then I'll talk to you tomorrow morning. Right.
Right.
So we use thyroid not for replacement, but to remove the adrenals out of the system. And it's only the
Interesting.
active, not the T4, just the T3 by itself, the active form of thyroid. And literally, I see people just drop and just fall asleep instantaneously.
Wow.
It is
That's
so
really
again. So
interesting.
we use medication for different. Now this for 99.9% of the people
Hmm.
is, guess what? Give them chest palpitation because
Yeah.
that's what it does. But the 0.1 percentile people, ooh, this is like a game changer for them.
Yeah, it's a trial and error then. You can say try it, and then if it
Uh,
works, then you know,
I,
right?
I know what they work on, so we
Yeah.
have a whole questionnaire for that. And if you know
Okay.
that there's adrenaline is kicking in, these are the people, or epinephrine, norepinephrine. There's all those neurotransmitters that they kick it in to stay them focused and alive at all times. This is what I use to bring calmness in them. And after that, they
Mm,
still practice meditation. They still practice deep breathing because without that, the brain is not focused enough to make decisions.
interesting.
So
Yeah,
the reason I say these things is because everybody is different.
right.
Identifying the right
Absolutely.
medications, the right path is different. And
Yeah.
that's another reason why I mostly focus on doctors, is because I train the doctors to look for these kinds of things and do the right treatments for the patients. And if it doesn't work out, that's him and or her and I will get together, discuss the options. And so my job is to bring in ideas to the physicians to help the doctors, because I can probably talk to 10 doctors in a day and they can literally help 200 patients versus
Wow.
by myself, I can only see 10, 15 patients a day. And
Right.
I cannot make an impact that I can. So that's a choice I have made.
So, what else do you recommend for women who are midlife who can't sleep? That any kind of sleep recommendations?
Of course. And so the midlife people, they're not sleeping better is because they have too much of estrogens.
Oh, okay.
And here's the thing. Midlife crisis it's all about stress management.
Okay.
Everything is like snowballing. You have teenagers more than likely.
Yes. Uh-huh.
Uh, More than likely, your spouse, right, is going through his midlife crisis, and
Right.
guys are the worst at midlife crisis.
Uh-huh.
They just cannot. They're in this tunnel. They're in this tunnel. They do not know how to get out of it, and they think there's no end to this tunnel. And of course, they want support from you, and where you are going through your own issues. And it
Yeah.
says, wait a second, you're not there for me. Why the hell am I coming for you?
Right.
And so
Absolutely.
there's a tug of war that's going on, and divorce is absolutely not the answer, because guess what? If you're not helping your spouse go through a tunnel and come out at the other end, then you'll be dealing with the same issue with some other person
Right. Yeah,
in
that's
the next
true.
marriage. And so,
Right.
you know what? There is no greener pasture someplace else.
Yeah.
You have to figure out a way to connect to each other and see that, hey, can we talk? Can I tell you, or can I hear you what you're going through? And then hopefully can you hear me what I'm going through, and see if we can
Yeah.
find a better path. We can do the hormone therapy to kind of bring some of the neurotransmitters back in the balance, so you have the brain capacity to understand those kind of things.
Yes.
Because if you're just going butting ahead against each other and trying to resolve this without any medication balances, it is a very difficult process. And so my job is to hopefully educate you, tell you that, hey, I'm not going to tell you that life is going to get better. I'm going
Right.
to tell you that I'm going to give you the medication so you can focus better. But the focus is to go on two things: stress management, food management. Okay,
Okay.
those
Wait,
two,
sleep. What about the sleep management? You were going to
those
give us
those
some
those
tips.
those will come as soon as you manage stress. You
Oh, I
sleep better.
see.
You
Okay,
sleep
got
better
it.
because
Okay.
sleep is a focus issue.
Yes,
It's a
okay.
it's a cortisol issue, or
Yeah.
in some cases, it's adrenaline issues. And if you are getting jacked up on social media right 3 hours before you go to sleep, I mean, there's not much I can do about it, because that social media is bypassing the cortisol defense system and kicking on your adrenalines.
What about progesterone, though, that you probably
So
compound at your
progesterone
pharmacy?
can help you calm down a little bit,
Mm-hmm. Mm-hmm.
brings the estrogen testosterone into proper balance. If you
Mm-hmm.
take an oral progesterone capsules, it will get broken down to L-pregnenolone and then binds to the brain receptors and bring calmness and hopefully sleeping down for you. Right?
Okay.
So those are all pharmaceuticals being used to kind of help you bring the sleep down so that you can sleep. You can at least fall asleep and get in the sleep pattern.
Right.
But what's going to keep you over there is the meditation before you go to sleep. No social media at least 3 hours, if not
Okay.
5 hours before you go to sleep, right?
Okay.
No excitement from your work. That means the laptops are turned off and all those things.
Yes.
I know it's cringing
Stress.
time. It is stress. And people are having a hard time shutting things off.
Yeah.
Having meaningful conversation with your partner, with your kids, and connecting with them, and no judgments, right? I have
Yes.
teenage kids in my house right now, and of course, their way of communicating is talk through the door because I don't want to see your face, sort of a thing, you know. And I get that part, and I will try to slip a note underneath the door. I said, "Hey, I miss you. I would love to chat with you," you know, things like that. Just want to connect with them somehow, you know. Just
Yeah.
make it open, make it fun, and do whatever it takes to connect, because teenagers, their hormones are raging, and
Yes.
and and they're going through the problems, and they think I don't understand. And I tell my daughter, I have two daughters, I tell them, I said, this I do for a living. I treat people's hormones for a living. Dad, no. You're not going to talk to me about this thing at all. Right? So I think that's okay, right? That's okay. So I make it more fun, more livelier for them. Hopefully they'll open up a little bit with me. And then of course I teach my wife so that she can talk to the daughters about those kinds of things. But at the end of the day, it's the person that is level-headed has to make all the moves.
Yeah, that's
Right?
absolutely right. Yeah. And some advice on teenage daughters, because I'm very good with that's kind of my forte, is as long as they know, I heard this analogy once, I read it in a book. Teenagers in general are like people who are swimming in the middle of the pool, and you are the side of the pool. So they're treading water, as long as they know they can go to the side of the pool and lean on the side of the pool when they need you. That's good. So you are the side of the pool. So they will come to you when they need you, as long as they know you're there. So the fact that you're slipping those notes under their door, showing that you love them, that you want to be there to talk to them, that is all they need. So you're doing a great job, doctor.
Oh, thank you, thank you. I heard that from somebody else too, and that's why I just want to connect. I try to make it very easy for them, and they think that my dad, you just everything's a joke to you, everything is just funny to you, but life is serious. I said, I know life is serious, but we don't have to be serious all the time.
Yeah.
You can have fun living your life, right?
Yeah, I love that.
Yeah.
Okay, so tell us about, let's go into another hormone, You gave us a lot of information. We talked about estrogen. We talked about progesterone. We talked about the thyroid. We talked about cortisol and adrenaline. What about GLP-1s, peptides? I hear
Ah,
that peptides are like the penicillin of our era. They are remarkable. They're going to change the way we receive medications. Let's talk about peptides. There's so many different peptides too that some of them are not legal yet or not given in California.
so,
What are they?
so Tara, before I answer the question for you, we forgot to talk about one more hormone, which is
Oh,
testosterone.
okay. Oh,
This
yes,
one,
testosterone.
just briefly go
Yes.
to testosterone right now because
Yes.
testosterone is the number one hormones in men and women.
Yes.
The,
In women.
the second part is true, and women. Okay, so
Yes.
if you think that testosterone is just a male hormone, no. The number one hormone in humans, period, is testosterone.
Thank you
The
for bringing this
only
up.
the only reason we have high estrogen, high progesterones throughout the month of the cycle is to procreate, is to have babies,
Yes.
right? And that's when, because estrogen level will rise up to very high levels in the hope that you get pregnant. In the absence
Yes.
of pregnancy, they will drop. It's same thing with progesterone. The progesterone levels will rise in the hope for pregnancy, and they will drop eventually, and it will go back to normal. But the testosterone level is the high all the time, and
Okay.
it slowly starts depleting very gradually over time. The testosterone hormone is absolutely necessary for both men and women because that brings your libido enhancer, sex drive, your skin texture. That's what the
Oh.
guy's testosterone is. The testosterone makes your skin thicker, right?
Uh-huh.
And women have thin skin because they have low testosterone levels out. But
Oh,
but
that's
the
why my
thing is,
veins show.
but the thing is, the testosterone, if you get too much, it can cause acne and hair growth. So there's a fine balance about those kinds of things. So testosterone, don't get me wrong, please talk to your doctor. Make sure that's part of your balancing out regimen, and it's a must for every human being.
I take it through
Perfect.
compounding pharmacy, and it's like a little pea size. I forget to take it a lot of times. My testosterone was really low when I went to go do my labs. Now it's looking like it's better. Why has it been hard to get testosterone made for women? Why do men get to have it and it's been so difficult
because
for women?
because there is no product approved for females, period, by FDA ever.
Why? That's
Because
just ridiculous.
so keep in mind, the whole North American Menopause Society was run by four guys
Mm,
for all the decades, for century. Guy OBGYNs telling women how they feel. I mean,
yeah,
it is absolutely ridiculous.
ridiculous.
It is ridiculous, right?
Yeah,
How do the guys know what you're going through? They never
they
to go through
don't.
labor pain. They never to deliver a baby.
No,
What do they know? What would we
that's
know?
true. Yeah.
How does it feel like to have to be in a woman's shoes? So until this time, now thank God the black box warning is gone right now. There's a lot more research is coming out. A lot more doctors are now on board to looking at this whole picture. So all these things is all going the right direction. I know there's one pharmaceutical company right now actually is taking the testosterone and they're doing human trials for females right now. And so
Good.
over the next 3 to 5 years, we may have a first drug approval for female patients for using testosterone. It's a game changer. I know the CEO of the pharmaceutical companies and his passion driven. He's not about money at this point. His passion, of course, he wants money too. But no, I'm okay with that. But give me a product that I can use, right?
Yes.
And
Yeah.
so he's putting all his resources into bringing the testosterone for women right now. So yeah, don't get me wrong. It's a must. And we are hoping that in the next 3 to 5 years, we'll have an FDA approved product available for women.
But you at your pharmacy do
Oh
compound
yeah,
testosterone. So thank
we
goodness for
do.
compounding pharmacies.
Yes, we've been doing that
Yeah.
forever. And by the way, we didn't discuss this part out, but the thing is, keep in mind, all hormones, if you're taking, all hormones are produced endogenously. That means they're produced in your ovaries. Our job is to get the hormones as close to ovaries as possible. So all my hormones that go topically, they go to the inner labial application. Because
Okay.
from that point onwards, there is no dermal fatigue. There's something where you keep rotating sites all over the body. But if you apply to the inner labia, you can apply the same spot for 25 years, no problem.
Oh, interesting. That's why my
right?
doctor says to put it there because I was
Yep.
wondering why. Because some
So
people
that's
put it on their leg.
Yeah, no, but the leg is only good for progesterone because it's such a large volume, and to
Okay.
apply intravaginally that large volume is very messy and it's just not fun for the lady. So apply the lower abdomen, inner thighs, things like that, where it's as close to ovaries as possible still, but
Okay.
not
Oh,
inside the
okay.
ovaries.
So that's really good that you explained that because I was always wondering, is it for libido that you're doing that? But it's not.
No,
It's because it's close to the ovaries. So that's very good
it's for
information. Thank
absorption
you.
issues. So
And
now let's talk about peptides because that's a good ask me
yeah,
question.
let's talk about and before we get into peptides, I have a question. Can you tell our listeners what is a compounding pharmacy? Because
Okay.
we're told to go. I know it sounds very elementary, but
Yes,
at the same time, we're hearing about compounding pharmacies now because we're talking about peptides and
absolutely.
we hear a lot about them. So tell people why your pharmacy is different than a regular CVS.
Okay, so
Mm.
I actually know the first compounding pharmacy in the United States.
Oh,
It was in Newport Beach, California.
uh-huh.
It was the first compounding pharmacy in the United States. Dr.
Wow.
Feldman, who ran that pharmacy, actually unfortunately passed away.
Oh,
But I had the opportunity to work with him and learn from him and all those things. And because of him, I this is when I was at a pharmacy school, right?
okay.
In the in
Wow.
the in
Uh-huh.
the early 90s, right?
Uh-huh.
And he opened up a pharmacy back in the 70s, right?
Wow.
And so even in 90s, there were only like 3 to 5 compound pharmacies in the whole state of California.
Mm-hmm.
So
Because I had never heard of one. Yeah.
when I first opened a first compound pharmacy, I was like, there were like only like 5 or 10 of us in the whole
Wow.
state of California. And
Amazing.
so
Yeah.
I've been doing this compounding business for a long, long time. All the compound pharmacy means is that a pharmacist actually makes the medication for you on premises.
Okay.
They discuss with the doctor. Compound pharmacist is not just the guy that makes the medication and gives it to you. No, the compound pharmacist is actually talking to the doctors and learning what the patient's needs are, coming up with a solution and going back and making those medication work with the physician so that you get the right treatment options for you.
Wow. That's
Right.
great. Okay.
And so, for
Okay.
example, if you're applying to the label application, I have to be very sure that none of the products that I use, none of the bedding agents or the creams that has even a dot of alcohol in there because otherwise it will burn. Right?
Okay. Got it.
Those are the kind
Okay.
of things. So we had to work everything around and said, hey, I'm just going to apply to the lower abdomen and inner thighs. And so what if they apply a little bit to the outer labia or inner labia? I said,
Okay.
they may happen that too. I said, okay, I'll make sure there's no alcohol in there. Instead, I'll just use some mineral oil in there, and so make it a little bit smoother. So those are
Okay.
the kind of things that we talk about, we work together, and then we find out what the goals are, and the goals are met with the dosage form. That's what we create. So that's what
Okay.
compound promise is all about.
Okay, good. So
And because,
now we've got that done. Now we know that
and
some GLP-1s and peptides come from compounding pharmacies. So let's talk
so
about peptides.
so here's the shocker for you.
Okay.
1999, we were the first company pharmacy in the United States to actually make the first peptides.
Oh, wow. Amazing.
And at that time, they were not called peptides, they were called hormones.
Okay.
Because hormones are a bunch of amino acids coming together, right? Like if you don't call insulin a peptide, but insulin is a peptide,
Okay.
right?
Okay.
And so, but the thing is, nobody was allowed to make anything with amino acid chains products in the company pharmacy. So we were the
Mm,
first company pharmacy to bring peptides in the pharmacy because at that time the regulations were not there. FDA
okay.
did not know what to do at the time. Nobody knew what was going on. So we were hiding under the hormones, and we started making peptides and making it available to the doctors. And in that, we started actually making the first peptide that we worked on was glutathione. Is a tripeptide, 3 amino
Okay.
acid chains coming together. And the reason that was intriguing to me is that's the most abundant molecule produced in the human body. So I said, hey, if I can figure that portion out, I can actually help people live in perpetuity forever. That was
Wow.
my, I mean, that was my overarching goal 27 years ago, and 26 years ago. I said, oh my God, if I can figure that portion out, I can literally help people live in perpetuity. So that was my whole life I've spent on that one. And now today we have a bunch of patents
Wow. Look at
on
that.
on this molecule, on how we delivered them. And so the only peptide delivery that we have patented, it's my patent. So
Wow.
let's talk about, because people want to know about GLP-1, and this peptide is going to be the next biggest movement. And in
Yes.
the reality, the answer in short form is no. I'm
Okay.
sorry. I'm not here to
Oh,
bust your bubble.
interesting.
I'm not here to bust your bubble.
Uh-huh.
I'm not here to give you false hope. But just to let you know, GLP-1 is the first peptide that actually showed some promise when it
Uh-huh.
came to semaglutide. But before that, there were two other GLP-1s that did not work.
Which ones?
There were Byetta and Victoza. Two
Okay.
GLP-1s that were approved by FDA 10 years before.
And did not work.
They did not work.
Okay.
So just because this drug worked, now the whole category also, oh my God, all peptides are good for you.
What about
And
tirzepatide?
tirzepatide was the second peptide that got approved, right?
Uh-huh. Mm-hmm.
Right now they have this new one that's coming up, and there's all this new, all GLP-1s are coming out. These are all different variations of GLP-1s. By the
Mm-hmm.
way, GLP-1 is produced in your stomach.
Yep.
When you eat food, the body sends a signal to your brain and say, hey, stop eating up, I got enough. Right? So it's a signaling molecule. The signaling needs to be there. There's so much noise in your body, the signal doesn't get to your brain. So for example, if you're at a party at your house, you just call a whole bunch of friends at your house, and you have a small house, you're in Northern California, so you can't afford a big house anyways, right? You have a small house, you call a whole bunch of people coming to you, and so there's just chit-chatting. But the thing is, you can't hear because everybody's chit-chatting, right? So what do? You talk louder.
Yeah.
Well, if you make an announcement, what do? Either you tell everybody to shut up.
Oh, yeah, you have to be quiet. So you're right. Ding, ding, ding.
But here's the thing. In medicine, we can't tell people to shut up.
Uh-huh.
In medicine, I said, hey, I cannot reduce the noise in your body down because there's too much other inflammation going on, so I can reduce the noise down. So instead, I'm just going to turn up the volume.
Okay.
So when you increase the volume, what happens? You can go deaf, but you don't realize until the next morning. I said, oh my God, I can't hear anything. This party was just knocked me out.
Yeah.
And that's what GLP is. It's just increasing the volume.
Okay.
It's not that you don't have enough of it.
Oh,
There's
okay.
too much noise in your body. You see that part? Now, when I tell this story like that, people goes, oh, how do I reduce the volume? I said, great question. That's what I want to do. Stress management, insulin management, thyroid management, and sex hormones. That brings the noise down. Simple stuff. Now, when I say the thing, there comes the pyramid again. So if we are hoping for a miracle that's coming in the pipeline because our drug companies are going to give this peptides to you, please don't get your hopes up too high.
Okay.
If it does work, it's a 1 in a million. But
you hear people like even Oprah Winfrey did a podcast a few weeks ago, saying with a doctor saying that the peptide has changed her life,
and that's okay, and that means that it is doing the symptomatic relief, but we don't know at what cost. So, for example, one of the other peptide which is very popular, which is not legal in the United States at all, is BPC 157. It's very popular right now.
What does that do?
The BPC means it's a body protective compound.
Okay.
It is made by your stomach. Made by a gastric acid. Okay. So keep in mind, since 1977, we have been overprescribing antacids.
That's true.
Right? H2 blockers, Tegamet, Zantac, Pepcid, Prilosec, Nexium, Protonix. There's a slew of drugs that are out there to wipe off all your stomach acid.
Yes.
If you have no stomach acid, you have malabsorption. You have issues with absorption of the nutrients. You have no stomach
Bone
acid.
density.
Oh, there's a whole sheet of problems right now.
Mm-hmm.
And the
Mm-hmm.
BBC 157 is also produced by stomach acid. And so now, oh, if you have joint repair issues, don't worry. Don't build your stomach acid. I'll give you a peptide.
Mm.
So again, I'm now if you grew up in that era and you have no stomach acid, this peptide is going to work for you, no doubt
Mm-hmm.
about it, no doubt about it.
Right.
But for me as a pharmacist, I'm thinking, I said, hey, how do I future proof this generation? How to
Mm-hmm.
take care of my kids today so they don't have to rely on this medication that is not actually solving the problem, is just putting a band-aid over the symptom.
Yeah.
So I'm
Yeah.
educating people to think of peptides as, now there are two types of peptides.
Uh-huh.
There are bioregular or signaling molecules, which is what we are talking about, or they're worker bees that actually does the work for you. So
Yeah.
I am all about the worker bees, right? It's like, do you want a mother-in-law who tells you what to do, or a maid that actually does something for you in your house? Which one would you rather have?
I like to have the maid that does something for me.
Exactly. And so mother-in-law is a peptide that is a signaling molecule that tells you what to do.
Mm-hmm.
And Tara, you better do it, right? Versus a maid is actually doing the work for you. And you don't have to tell them, it just knows what to do. So
So you're saying the stress management, getting all the things that we talked about earlier is the maid?
so the maid is the two peptides that I'm working on.
Oh, okay. Let's talk about
The,
that.
the first peptide is glutathione. It's
Okay, let's talk about that.
the most abundant product produced in the human body is glutathione. And the glutathione, I mean, there's IV drips, which I introduced IV drips by 25 years ago. Then there's liposome technology products, oral capsules, all kinds of things. Actually, nothing ever absorbs into your system. All these peptides have to be produced inside your body in order for the body to use it as a worker bee. If
Okay.
it's a signaling molecule, you can inject it and the body says, okay, tell me this, tell me what to do, and I'll do it. But if you have to put them to work, your body has to produce inside the body.
Okay.
And if you take it from outside sources, the body will just break it out.
Oh,
So
interesting.
we have right now we have close to 12 different patents right now on different on the same molecule, on how we got them stable as in a water-based system, get through your skin on a skin cells, and using the skin cells to go from one skin cell to another to all over the body.
Wow.
So
Okay.
that's our technology pieces. And when it gets inside your cells, there's a cell-to-cell transfer that's happening that gets all over the body and does a trick for you. And that's a worker bee. So you can see the results like within few minutes to up to 14 days. So
And what
like,
does glutathione do?
oh my goodness. That's okay.
That's a
Easy.
whole other podcast, I know, but
That's a
maybe
whole
that's
other
part
podcast.
two. So let's tee it up for
So
next time.
what I can tell you right now is, again, I'm sorry, but I'm going to give a plug to my book, The Glutathione
Okay.
Revolution.
Yeah. Yeah,
Took me
please.
The book is called The Glutathione Revolution. Took me
Okay.
12 years to write this book because each and every story is in there. I've
Okay.
collected those stories for 12 years. This is while I was researching this product before this was available to the public. It took me 14 years to write the book, get the product ready, do the research, and release the product to the public. Right. So the
Wow.
first 12 years, whatever I did, I wrote in a book. So please get a book. The cheapest way to get in the book is Audible, or it's in the audio. It's like a couple of bucks. Or if you have a membership, it's free. Get
Okay.
the Kindle. There's an electronic version for like $2-3. The print copy is about $25-$30. Whatever suits you, get the book, hear the stories. I can assure you, you're going to become. I said, I'm intrigued now. What am I going to do now? So again, it just to give you an idea, every single disease in the world that causes death has linked to oxidative stress. And
Okay.
the only way to reduce oxidative stress down to zero is glutathione.
Oh.
So that's what I'm saying. If I can figure out glutathione, I can help you for the life in perpetuity. And
Uh-huh.
when you said the peptides are the new penicillin, the reason that when you said the word penicillin, it triggered me one more thing. 100 years ago, the only drug that increased lifespan by 2 decades was penicillin.
Penicillin, yeah.
Right? But today, if you tell I'm going to give you penicillin to increase lifespan, I said, no, God, no, you're going to kill me.
Yeah.
Because at that time, people were dying off of infections.
Right.
We got this thing covered. Today, everybody's dying off of oxidative stress leading to end-stage diseases.
Okay. Yeah.
If I can reduce and if I can control oxidative stress to zero, and if I can postpone end-stage diseases to 20, 30, 40, 100 years, I mean, honestly, we can live in perpetuity. And that's what this whole thing triggered up. So that's the first tripeptide. The second peptide is GHK copper.
Okay.
It's also part of your plasma. And that GHK copper is the ultimate beauty peptide because it gets lodged in your skin cells, your joint tissues, your tissue repairs, your wound repairs from inside. Because your body is constantly if you exercise, is breaking those tissues and the muscle fibers. Somebody has to go fix it. That's the GHK peptide that the body uses to fix those issues. Those two products are the worker bees. Those products are now available topically through my company. We are the only product in the world that has multiple peptides that can actually deliver these peptides into your cells. Which nobody
How do you get them then? Which doctors do you have to?
This is OTC, over the counter.
Oh, okay.
You can just go to the website and pick it up and buy it. You can go to the pharmacy to get it. But we have another website which is called Auro Wellness, AURO Wellness, and AUROskincare.com. You can get those products in directly, and literally within 30 days, you will see a noticeable difference in your body. I'm not sure what that is because oxidative stress is linked to 1,000 different problems. So I have no idea how it's going to help you. At the very least, you can have increase in energy. People have claimed to have the sleep pattern gets better, your HRV starts increasing. And so it has multiple effect on the oxidative stress markers. And if we can reduce that down, game over.
Wow. Okay. Well, this has been really great. So I will put that in the show notes so that people know where to look for that. And also your book. And we're going to have to do another session because this is so interesting and you're so full of knowledge. Anything you want to leave our listeners with?
Well, for the listeners, I want to make sure that I'll show you one thing, that I don't care where you are in terms of your life cycle. You could be in your 40s, you could be in your 80s, doesn't really matter, right? My goal is to help you, give you ideas and tips to reverse the aging process. So please listen to part 2 of this podcast, because I can assure you that the part of this podcast is going to blow your mind off, because we're going to dive detail into this peptide business, but not just the mother-in-law peptides. We could talk about the worker bee, the mate peptides, which actually does the work for us without even rethinking about it. And that peptides is going to change our trajectory on how we age gracefully. Hormonally, we can help you. Absolutely, we can take care of that part. But that's a 10% total solution. I'm going after the 70% of the total solution, which is your diet and your stress management. That's where the real solution is, okay? So please, there are no easy fix. I'm here to help you, right? Do what's right for you, and let's age gracefully together, because we're all on this journey together.
I love that. Thank you so much, Dr. Patel. I really appreciate all this amazing insight.
Thank you.
Thanks for listening to Talk with Tara. If you loved today's episode, please follow the show and share it with a friend. Stay tuned. There's so much more to talk about. See you next time.